Kidney stones are a very common problem, but most people deal with them incorrectly. Watch this video until the end and you'll find out what you really need to do to get rid of kidney stones. Of course, you've probably already heard many times that the main cause of kidney stones is either an improper diet, especially when you consume foods that are rich in various types of salts. For example, foods high in calcium or phosphorus, or uric acid, and this is the main problem because these salts accumulate and that's how stones form. Others say that no, that's not the reason. The reason is, for example, that you have a bloated intestine and that's what causes it. Or an improper combination of foods. That is, basically all the problems are related specifically to diet. But where is the mistake here? The mistake is that, for example, there are people who lead a healthy lifestyle. For example, vegans try, or vegetarians, to lead what they believe is a healthy lifestyle. But they also develop kidney stones. In the same way, for example, stones also form in animals, in dogs and cats. Do they really eat improperly? So what is actually the main cause of kidney stone formation? Let's figure it out. There are several main types of stones. These are urates, phosphates, and oxalates. These are the main ones. So for example, let's talk about urates. Urates are salts of uric acid. And if you look it up in the literature, you'll read that urates do not form in the kidney itself. They form specifically in the renal pelvis. That is, this is the area where urine collects. The kidney filters the urine and then the urine flows there. But for example, oxalates and phosphates will never be found specifically in the renal pelvis. They will be located in the so-called calyx pelvis system, higher up. So what is the reason for this? And a very interesting point is that these are simply different types of reflexes. That's what we were talking about. Let's now study the reasons why these different types of stones form. So if we talk about urates, the reason for the formation of urates is a reflex reaction that occurs when a person finds themselves in conditions where their boundaries are violated. What are these conditions? It's not that she thinks about it or worries or gets stressed about it, as people often assume. She simply finds herself in these conditions. So what are these conditions? It's when, for example, someone from outside, a neighbor or someone else, invades your home or say your street or your territory. Right now, for example, there is a war and the enemy is invading our territory, everything that we consider our own. And that's why a huge number of people here are developing stones called urates. Another scenario is when it is related to an intrusion into my professional activity. For example, someone tries to take my place at work, someone is after my position, someone is claiming my award, and so on. The same situation arises when there is an encroachment within relationship. For example, my sister comes home and feels like she owns the place and I don't like it. She comes over when I don't want her to. Or for instance, a child doesn't have their own room. Or for example, guests keep arriving unexpectedly and uninvited. I don't want that. Also, for example, men can develop ulcers when another man makes advances toward his wife. For instance, someone starts courting his wife or his partner. The same situation will arise when there is an attack, for example, based on some religious beliefs or other reasons. With children, very often, what is it? Is it really improper nutrition, as they tell us? Children very often find themselves in such situations when someone encroaches on their territory. At school, in kindergartens, on the playground, at home when a father exerts his authority, and so on. All of this will cause certain changes, the essence of which will lead to a constant inflammatory process specifically in the calyx pelvis system. And this will lead to the formation of what is called uric acid stone. But as I always say, you don't need to take my word for it. Check for yourself, for example, if you take animals, a cat or a dog, you have a beloved pet. And if you get another pet, for example, another cat, and you pet it while constantly shooing the first one away, after a certain period of time you'll see that it too will develop kidney stones. And these stones will be urates. This once again proves that the cause of urates is not food or anything like that. Yes, the point is that at the moment these stones are forming, the kidney will retain more urine. And the mistake is always that we're told we need to drink more because the urine is concentrated, so that's why if your urine is concentrated, you have problems, because stones form. That's as true as saying the sun rises and sets. Now, the second important point, when we talk about oxalates and phosphates, these stones will never be in the renal pelvis. They will be specifically in the calyx pelvic system, higher up. And the reason these stones form is completely different when a reflex, that is, the conditions a person finds themselves in, is called a dead end. A person doesn't think they're in a hopeless situation. But verbally, if we describe this reflex, the kind of situation a person finds themselves in is, for example, when they see no prospects for the future, they've moved from one country to another, and here they can't manage to build their life. They feel like a refugee here. Or for example, when there is a war going on right now and there are no prospects, no idea when it will all end, what comes next? Businesses, jobs, livelihoods are being lost. This also leads to such changes. Another situation is when, for example, some kind of medical intervention is needed. And I don't want to, but I understand that I will have to. For example, certain happiness injections might be administered. Or, for instance, other procedures that a person doesn't want to undergo but has no choice. It's the same situation when a person feels lonely, abandoned, and unwanted. For example, when an elderly person ends up in a nursing home. Or, for instance, when their children abandon them. Or, for example, when they lose people close to them. That is, when they feel, let me repeat, abandoned and lonely. In general terms, this can be described as being torn away from the familiar, comfortable environment and placed somewhere uncomfortable. This very discomfort of the new environment where the person finds themselves is what triggers this reflex. As soon as this reflex is triggered, when you find yourself in so-called hopeless conditions, the body starts to operate in a specific mode. It tries to conserve resources. What resources? In this case, it's water, so the volume of urine decreases, and also nitrogen, because in critical situations, when there's hunger or deficiency, the liver is able to synthesize what from nitrogen? Proteins. This is a protective reflex. A common mistake made by doctors and people who believe that all of this is caused by diet is thinking that an increase in creatinine and urea levels means something else. And they say this indicates that kidney function is impaired. No. This indicates that it is specifically the kidney's function of retaining water. The kidney contains a huge number of these very thin tubules. As soon as the reflex at the brain level is active, the brain gives a command and the kidney narrows the number of these tubules. On average, each kidney has about 2 million of these tubules. That's the essence of it. And you can easily verify this by getting a CT scan. And right now you can see on the image what it looks like. So any doctor who sees this kind of picture on a CT scan will know for sure that this person has oxalates or phosphates directly in the calyceal pelvic system. These are the causes of occurrence. But now let's talk about what negative consequences these stones have for the body. Of course, we're always told that if a stone is found in the kidneys, it's already a catastrophe. It's a disruption of kidney function. It will raise blood pressure and it will affect our whole body. Well, they always like to scare us. But what is the real danger of kidney stones? The danger is that when a stone moves further and gets into a narrow passage called the ureter, it can get stuck there. As it moves, it scratches the mucous membrane of the ureter, and the muscular ring contracts around it, that is the muscular layer in the ureter. Because of this, urine can no longer flow further. This leads to a condition called hydronephrosis. In other words, the kidney continues to produce urine and functions as before, but this urine cannot drain away, causing the pressure to increase. And now this fluid starts to exert pressure on the renal parenchyma, that is, on the very structure that filters the urine. If this process is prolonged, of course, the kidney will begin to thin out this filtration surface, and eventually this will lead to a negative condition known as kidney failure. This is important to understand. Therefore, of course, when hydronephrosis occurs, urgent medical assistance is required. But in most cases, kidney stones do not lead to any complication. So now, understanding the causes of their occurrence and the negative consequences that may occur, though there aren't that many of them. Let's talk about what needs to be done to prevent kidney stones from forming. When we talk about prevention, it's not about nutrition or taking some specific remedies. Because if you don't eliminate the reflex, meaning if you don't change the conditions or make sure your boundaries aren't violated, nothing will work. So the right thing to do is always to eliminate the reflex according to what I mentioned above. Let me give you an example. A person was constantly developing stones, urates. With urates, as we discussed, it's a constant violation of boundaries. Here's what the situation was in this particular case. He had to share his house with his mother-in-law. Yes, after all, she's his wife's mother. She treats him well, cooks and everything. But he felt uncomfortable when she would, for example, change the towels or do something differently. She didn't do anything harmful, but he still felt uncomfortable. All his life, he wanted to live alone, just with his wife, of course. And so he says, what should I do? I just don't know anymore. I keep treating it, but nothing works. These stones keep forming again. I said, there's one option. Your mother-in-law needs to live separately. Then your family will be stronger and there won't be any problems. He said, okay, I understand. He helped his mother find a place to live where she stayed, and she no longer intruded on their space. She would always let him know before coming over, and as a result, he stopped developing stones. He says, I was being treated for 15 years. And they kept forming all the time. But here, with such a simple method, and now he doesn't develop them anymore. So remember, just by changing the conditions, the change in conditions leads to the elimination of the reflex. And if there's no reflex, there will be no formation of stones. But when they are already there, what should you do then? So when the stones are already there, is the first step perhaps a diet? Again, no. The first step is once again to look for those causes that triggered the reflex. If these are oxalates and phosphates, then it's always a dead end. But if these are urates, then it's a violation of my boundary. Of course, you can try to limit uric acid or foods rich in calcium or phosphorus, and you might think this will reduce something, but nothing comes of it. Another mistake people make is thinking that if they drink a lot of water, it will dissolve the stone. This also doesn't work because reduced urine output doesn't occur as a pathology, but rather as a consequence. It's a reflex triggered by the brain that makes the kidney work this way. So you can drink a bucket of water, but the kidney will still retain a certain amount of fluid. This is another mistake. So you don't need to drink a lot of water. But how can you help your kidney? By taking salt baths. That is, for 100 liters of water, you take 900 grams of salt. The water temperature should be 37 to 38 degrees Celsius. You immerse yourself in this water and stay there for 2 to 3 to 4 hours, as long as you can. If the water cools down, you can add a bit of warm water. What is the essence of this method? The point is that when you are in the water, biologically, for the brain, this is the highest degree of protection, the highest degree of comfort. You might say, wait, how does this work? It works as follows. For 9 months, each of us, and animals too, were where? In the environment you created, it was the womb inside your mother for 9 months. That's why, biologically, the brain shuts off all these reflexes when you are in safe conditions for yourself. So, by being in the water, you turn off these reflexes. How long should you stay in this water? As long as you can. The longer, the better. But additionally, what else can you do? Additionally, you can also use certain remedies that will stimulate what is called the dissolution of the stone. And now I will tell you about such a recipe. Here is a recipe that, in my opinion, is one of the best for reducing kidney stone. Among people, this is called stone crushing. It is suitable for everyone, for urates, for phosphates, and for oxalates. So, what does this recipe include? This recipe includes, first, dill seeds, bearberry leaves, and field horsetail. We take 2 parts of each, and carrot seed. We take 3 parts of that. Mix all of this together, that is, we make this proportion. Next, take 1 tablespoon of this mixture and pour 500 milliliters of boiling water over it. Let it infuse for 12 hours. The maximum is 24 hours in a dark place. Then strain it and take 150 milliliters 3 times a day, 30 minutes before meals. You will need to take it for a long time, at least 2 to 3 months. Then take a 1-month break and repeat the cycle. That's how it's done. You need to complete 2 to 3 such courses. But remember, the recipe won't work if you don't eliminate the reflex. What are the main mistakes people make? It's thinking, I'll just drink water with lemon or water with apple cider vinegar, or I'll change my diet and the stones will stop forming, or I'll add some foods or take some supplements. That doesn't work. That's why you need to follow a specific algorithm where we eliminate the reflex. First, we create safety, and that also includes a bath. We use such remedies, for example, the use of medications for those who want to. If a critical condition develops, then you can't do without surgical intervention where these stones will need to be mechanically removed. So remember, proper therapeutic prevention will ensure your health in the modern world. And only a thinking person, and I am convinced that you are thinking people, will be healthy in this world.